the body is very wise. It communicates to us constantly. We just don't understand the signals.
I'm Petra. I had a vaginal birth after 3 cesareans. I'm a VBAC doula and birth educator, and I feel called to tell you that you deserve the birth experience that you want. I want you to join me every week to hear empowering birth stories, heart led conversations, practical tips, evidence based information, and yes, we definitely dive into the woo side of things too. My hope is for you to leave each episode feeling inspired and informed. Thank you so much for including me on your journey to be back. Now let's get into this episode. Oh my gosh, we have a jam-packed episode today. You get to hear from Joy Acaso, who is an anxiety support coach and licensed psychotherapist. She draws from her extensive training in neuroscience, somatic work, and complex trauma. She is helping clients reclaim their mental and emotional strength. She specializes in stress, anxiety, and trauma recovery, offering practical tools to help navigate the complexities of life. Whether she's conducting workshops or planning family adventures, she aims to inspire others to heal, grow, and thrive. And this episode is no different. We got to go through so many incredible subjects, going from anxiety, ADHD, to overwhelm when planning your VBAC. So let's get into this episode. I can't wait to hear for you to hear from Joy. All right. Thank you so much for joining me today, Joy. And like I told you before, I'm obsessed with your name. It just like makes me want to
Oh, yeah.
smile whenever I say it. So I love it. Thank you again for coming. I'm so excited for this conversation because I feel like it is overlooked by so many people.
Yeah, thank you so much for having me. Again, my name is Joy Acaso, and I specialize in helping women and now men also who are trying to overcome anxiety that could be rooted in stress, ADHD, or even unresolved trauma. And I have a background in psychotherapy, 20 years. And I think that just with all the clients that I've met with and the people who have, walked into my doors of counseling, it's just really evolved into this amazing thing of like, how can we deal with, anxiety? Because anxiety in itself is just there's no one thing, there's no one source, if you will, right? Like it's usually layers. There's so many layers that come with anxiety, and it's a, mystery for people, but I wanted to be able to walk them through that. And I had postpartum anxiety after I gave birth to my now 16-year-old daughter, and it was rough. And so just walking people through this journey has been such an honor.
I love that. And that is so important because I feel like so much of our society doesn't really showcase like I think we're getting better. We're making little dents in it, but we're nowhere near where we need to be when it comes to letting it be known that a lot more people have like postpartum anxiety or trauma,
Yes.
unresolved traumas, and
Yes.
just making it like normalized to talk about it, and nobody wants to sit there and be like, I'm traumatized, like this was traumatic. But the reality is, it happens. And, we have to try to make it more mainstream so that we can get people the help that they need and not feel shame about
Yes.
it.
That is so true. And we cannot shame ourselves into healing,
Yes.
right? And so we are here. You're right. We have made, significant progress, but we are unfortunately not there yet. And but the good thing is that we are doing, there's research and studies that are coming out each and every day. And in fact, anxiety is one area of mental health that we've seen a lot of progress in. And so, that is something that inspires me and propels me to do this work. And ADHD has come up as something that is more prevalent. It has become more prevalent lately. And there's what we call innate or acquired neurodivergence. So ADHD is under the neurodivergent umbrella, right? So acquired is, well, let's do the innate. Innate means that we're born with it, right? Like
Hmm.
we know we do brain scans, okay, it's there. Acquired neurodivergence is something that happens out of a traumatic event because in the midst of traumatic event, the brain has to reorganize itself to make sense. Well, first to protect so that we can survive, and that has to happen in milliseconds. So that happens under consciousness, away from consciousness, right? Um, so it reorganizes itself to protect and make sense of what happens
Yeah.
in that moment. So it blocks off whatever doesn't make sense. It's like,
Right.
okay, we're not good. Let's get rid of that.
Yes, yes, and I see that so much, and I love that you explain that because I didn't even understand that the difference between innate and acquired ADHD.
Yes,
And I'm sure there's other symptoms that are umbrellaed under that, but like going
absolutely.
into this ADHD to start, like it just makes me almost feel seen in a way because I didn't feel like I personally had ADHD before I experienced these traumatic experiences. Like I had, traumatic births, three traumatic births, and I became almost like hyper vigilant about things. And I had to
Yeah.
have things
Oh,
like a
wow.
certain way. And if it wasn't, I would be so stressed out and I didn't understand why. And I'm so grateful for my husband because he's such a patient person and he's just
Absolutely.
like gone through this with me and he's like, it's okay, like we'll figure it out. But not everybody has that experience. So if
Yes,
somebody is struggling with this, how would they even learn to know if they have this condition or
absolutely.
these different things?
No, that's such a great question. First and foremost, we have so many questionnaires out there that psychologists, psychiatrists, and even neurologists use, right? You've got a questionnaire, it's a checkoff list. You say yes or no to these things. But I caution everyone that do not rely on those questionnaires. Those things are good foundation, a first conversation starter, if you will. But you want someone who can come alongside you to ask questions about your childhood. For you specifically, you had a marker. Your marker was, okay, after this happened, then I started to see changes, right? So we want to ask, people like, have you always felt this way? Does it, if it goes back all the way to childhood, then yes, it could be ADHD. If you have a marker whereby after trauma or traumatic events, then you started to get distracted, you started to not focus anymore, then we treat maybe if there's an unresolved trauma.
Hmm.
So, two different pathways because if it is innate neurodivergence, which is ADHD, that's also, right, like a
Yeah.
different path. And so, those things. So, yes, questionnaires are good. And if the questionnaires are showing signs, dig deeper.
Right. And I think I love that you say, like, that's a good starting point, but don't stop there because there's so many things online now where it's like, take this question to see if you have trauma, to see if you have anxiety,
Yes.
to see if you have XYZ. And then you're self-diagnosing, which for some people, it might give them some relief, but to just stop there, I think is not the best thing because, like you said, we need somebody that's going to understand where that's come from, a person that's been trained to specifically work with
Correct.
somebody with this condition. Because for so long, I self-diagnosed myself and I truly did not understand it. I was just like, oh, well, I just have ADHD, like that's it. And left it at that. But once I personally started working with a somatic therapist,
Oof.
I finally
That's,
realized that I had like big T trauma, small T trauma,
oh,
and just
wow.
like
That's amazing.
yeah, so many things like and like you said, it's layered. And I didn't
Yes.
understand how to deal with each thing. So working with like somebody like you, this sounds like it's your wheelhouse. So how would you start to work with somebody that is going through something like this?
Absolutely. So, for example, a client will come to me and say, I'm anxious and I'm feeling overwhelmed, right? Because I
Hmm.
have this long to-do list. And then I would say, I'd ask questions about, well, what makes you feel overwhelmed specifically about the to-do list? Is it that you're not getting it done, or there's so many, in your list and things like that? And then I would ask, probably not in the first session, right? This is also something that I um, like to do with my clients is to kind of spread it out. I know that in our human nature, we want to like know right away. I want to know
Yes.
what I have. That's what people, right? Most people will come to me and say, I want to know what I have.
Yeah.
First of all, you're not crazy. What you have is a life, right? What you
Yeah.
have is that you're a busy professional. And so you have all these things going on, not just with work, you have a family, maybe you're going to school and all of those things, or running a business, right? Like all of those things can compound and affect everyday life. And so I would, ask them each aspect. I also do a very holistic approach. What that means is that you're not one dimensional. So I ask about the physical symptoms, the social aspect of your life. Do you have a support system? Then the family comes with that too. We
Hmm.
start to uncover if there's either neglect, abandonment, or trauma. And then we go also into the mental and emotional space as well as the spiritual space, if that is something that's important for them. I don't use any cookie cutter method. I like to really listen to my clients' background and story. The other day, I was asking one of my clients, and I said, okay, we need to figure out first, slowly, if this was stress induced or culturally something that was modeled to you and you just kind of like absorbed it
Yeah.
and adapted it.
Yeah, absolutely. And some people, don't realize, and I didn't even realize until recent years, that so much of who we are today, like how we respond to, and in this instance, we're talking to women who are planning for a VBAC. So that comes
Yes.
into people-pleasing tendencies towards authority type figures, which is your doctor. When your doctor's telling you, you need to do XYZ, and you're just like, okay, I don't want to make waves, so okay, I'll just do it.
Oh, that's such a good point. Yes.
So, but I know personally that came from my childhood because everybody just told me, be quiet, go be a good girl, stop doing that. And so that gets internalized. And then we start acting that
Absolutely.
way for so many years. And I think it's hard for us to realize, like, okay, this has been conditioned into us over years, maybe decades before we get to this point. So trying to unravel this is going to take time. And like you said, it's not a quick fix. It takes
That's right.
time and it takes that personal touch that not every practitioner offers. So yeah, it's really hard and it's so nuanced.
Yes, absolutely. It's not going to come out in 15 minutes, right? Or not even 30.
Yeah.
Right. Sometimes it takes, 3 sessions to remember what happened to me in my childhood. Okay, the people pleasing tendencies. A lot of the times we don't even uncover that until we've told our story. And so, be very gentle with yourself. Don't be in a rush to uncover everything all at once because that will also be overwhelming and that will
Mhm.
defeat the purpose
Yeah.
of the healing journey if you wanted all of it to just, come out. And so having a somatic worker alongside you, someone who can keep you accountable and validate, I'm sure you feel validated in those spaces.
Yes.
Yeah, and
Yeah,
so that
because
is helpful.
definitely. And it's the validation that you said that really hits home for me because I personally felt so much shame and guilt because, my I felt like my body was broken. It didn't do what it was made
Okay.
to do. And so I it was just so much guilt and shame surrounded by that. And I just thought, well, it's my fault, I did this. And so having somebody validate that, no, it's not your
Yes.
fault. You were put into a system that is sometimes, honestly, and it's sad to say, they set you up to quote unquote fail. And it's not that you
Yeah.
failed, it's just that's the way the system is set up to when we have this ultimate goal in mind and it doesn't come out the way that we thought it would, we feel like we're a failure. So that is a really hard one that just hits home and feeling that validation is like I remember the first time that my therapist told me it's not your fault. I literally cried my eyes
Broke down.
out
Wow.
because it is just so powerful to finally have somebody tell you and validate that it's
Yes.
not your fault. You didn't fail. And so anybody that's listening, like it's not your fault.
That-
It
That's
really
right.
isn't. It's not.
Yes.
Wow,
And
I'm
you're not
getting all
broken.
emotional right now just thinking about it. But yeah. So, I mean, how, if somebody doesn't have the resources to get somebody like you,
Oh.
how do you suggest that they go about trying to start this journey of healing?
Yeah, absolutely. In the comfort of your home, right? You're listening to this, you can start just first of all, sit with your emotions. I think somatic work, right?
Mhm.
I love somatic work. For those of you who are listening, it's really body awareness. Somatic work is coming back to your body, connecting with your body. So many times we approach our situations from a cognitive perspective, which is the thinking, right? We're thinking like, okay, what do I need to do? And we like to jump to conclusions because that's our human nature, or we like to jump to solutions.
Mhm.
But we can't know the solution until we're first aware of what's happening and we know what we're fighting against, right? We have to understand first and foremost what is going on. The body is very wise. It communicates to us constantly. We just don't understand the signals. We try to ignore whether it's the hunger, the pain, right? The aches, the headaches, the butterflies in our stomach. We try to ignore those signals. If you are feeling overwhelmed or you've had these chronic anxiety come up, I suggest or invite you to just sit down and then connect with your body as much as you can. Again, don't force it. You don't, some things may not come up right away, but that's okay. You sit, if you have not done this before, it's going to feel awkward. So you can set a timer for you can try 2 minutes, or if you think you can, do 5 minutes, that's good too. So you set a timer, let's say 2 minutes. Okay, I'm going to sit here for 2 minutes because I've been feeling overwhelmed and that's all I know. And I don't know why, I don't know what I'm going to do. Then feel into your body. See if the overwhelm is showing up in, is it your breath, right? Is it are you breathing faster than usual? Are your posture? Are you slumped over, right? Do you feel what we call constricted, closed off? And then tension. So you've got the breath, the posture, and the tension. Where are you feeling the tightness and tension in your body? Okay, so let's say 2 minutes is over. Then you can either now you can write down what you've observed, or if you're in the middle of a busy day, you can come back to it later, and that's okay. And so you write down, you know, any observations, and no judgment, right? We approach it with curiosity. We approach it with just facts. These are facts that my body's telling me. I am tight on my shoulders, I have neck pain, all of those things. And then in the second column, you can write down what are the thoughts that are coming up for you. On the third column, are there specific situations? So you've got three columns now, right? Like your sensations, the thoughts, and then situation. Um, and then as you lay that out, right, then you can start to ask yourself, you know, is there something that I need to address specifically right in this moment? Can it wait? Do I need more information? Because I think that do I need more information? You know, jump through that and just ignore, and we want to solve. And
Mhm.
yes, you will come to a solution, but you cannot skip, right, those steps. And
Yeah.
so when you have this in front of you, then you really can start to take on your healing journey, whether it's, you know, working with a somatic therapist, or maybe it'll spark you to, I need to read some more on this. There's so many resources, right? Free at
Absolutely.
the library. Yeah.
Yes, and I love this exercise because I actually have a membership and it's called the Journey to VBAC membership, and it's obviously for VBAC
Yes.
hopeful women. But in this membership, I have almost an identical exercise
I love
to
that.
help these women. And obviously, I'm not a psychotherapist, but this is what I have learned that has helped me. So
Yeah.
it's just one tool to try to help get it out of your body. Because, like
Yeah.
you said, holding it in, like I remember I was so tense, like I would clench my jaw, not even realize it, because I was just
Yes.
holding on to so much tension from those experiences. And I think it's so important to, get it out of your body because we're in our head too much, I feel like. And
Yes.
we think like, oh my gosh, I could have done this. Oh, I went to the hospital too soon. That's why I had this C-section. It's my fault. And, instead of telling yourself like everything that you did wrong, looking in hindsight, you know, don't blame yourself. You just don't.
Absolutely.
So if somebody is going through all of these things in their head, like I shouldn't have gone to the hospital, I should have hired a doula, I should have, would have, could have, all of those, how would you help somebody kind of through that situation?
Yes, I would work with you as far as releasing in the body, right? I would ask, well, when you are saying those things, let's take a look at what your body is doing, right? Like, are you clenching your jaw when you're doing that? Then we need to unclench,
Right.
right? Are you uh, breathing slowly, either slowly or constricted? Then let's, you know, release that also, right? Because it's so difficult to think when our body is still holding on, you know, to those tension and tightness, right? And then we walk through what are those thoughts. So we have to have it listed. Okay, so these are the thoughts, right? And then how is it showing up in your body? And then let's release it. Whether shake it out, we're gonna shake it out, right? It depends on the energy that your body is wanting to release. If it is an anxious energy, for example, right, then we need to shake it out. Shaking it out, by the way, doesn't mean that you've resolved it, it's gone,
Right.
right? We can come back to your thoughts. I
Hmm.
think people are like, okay, is that it? We can come back to your thoughts, especially if that is something that's important to you, right?
Hmm.
And then we can start digging. But the problem is sometimes we want to dig, you know, we want to dig right away, but what what happens is that when we want to dig right away, our body or nervous system, right? Our nervous system, it's not allowing our nervous system to reset because we're forcing it. We're forcing it to be positive, to look on the bright side, to just get over it,
Hmm.
right? But we can work. We can work with our thoughts of the shoulds
Hmm.
or could haves and things like that. So those are very important things that we can look into.
Yeah. And I also think it's important to kind of acknowledge that you might not be ready to face it. Because I
Absolutely.
mean, when I tell my
Yes,
clients, one of the things when they're planning a VBAC is an important part is processing your previous birth experience. But
that's right.
most women are pregnant when I'm telling them this. So, when you're pregnant, your hormones can fluctuate. And sometimes you might not feel ready to face what happened before. And I think it's important to acknowledge that that is okay. Because just because we're
Absolutely.
pregnant 18 months later after what happened that we may have perceived as traumatic, it doesn't mean that we have to face it if we're not ready for it, because then that could be creating more anxiety or more fear going into this now birth. So, if somebody feels like they're not ready to face it, do you have any tips for them to try not to bring that into this next birth that they are planning for?
Yes. And I think society or culture, right? I feel like there's only two options we have, or at least society and culture have shown us. We either have to withdraw or attack, and there's nothing in between. So I
Mm,
love that you brought that up. It's okay to just kind of like settle into, you know, you're right, I'm not ready, right? I'm not ready to face this. But if there are thoughts that you can journal, right? You can journal through it and just kind of release your thoughts. Um, you can also make sure that you don't let go of the basics, your routines, because those things or rituals,
mhm,
whatever name, right? The terminology matters to you. The terminology, use a terminology that resonates with you. So if you have rituals and routines, don't let those things go as you're going through this process of trying to figure out, you know, the birth trauma, right? Or resolving those things. If something comes up, then work with your provider. If you are ready in that specific moment, right? It doesn't have to be all of it, but if there is a detail, an event or situation that you're like, I can't, it just seems to stay with me and I can't stop thinking about it, bring it up to your provider and
mhm.
see if there is something that can be done for that right specific situation. But absolutely, readiness is also important for me as I work with my clients. I believe that when it is ready to be healed, it will come out, right? And it will
Absolutely.
get exposed.
Yes, definitely. Oh my gosh, I just love, like, we've touched on so many things so far, but
Yes.
one specific thing that I kind of wanted to talk about is because VBAC, p women planning a VBAC, they can feel so overwhelmed by all of the things that they feel like they need to do in order to plan or prepare for this VBAC experience. They're being told they need to go to the chiropractor, they need to see a therapist, they need to
Oh,
go,
yeah.
do all the things, pelvic floor therapy. Like there's so many things, there's like lists of things that people say that VBAC hopefuls should do. So if this is feeling overwhelming for them or they're having anxiety even thinking about all the things that they feel like they need to do, quote unquote, need to do, because they don't need to do any of them. But if they are feeling overwhelmed or having anxiety, do you have any tips for them to to kind of navigate that. Because if they don't want to do all the things, or if they do want to do all the things, but they want to do it in a way that's not overwhelming to them. Do you have anything that they can do to
Yes.
make that easier for them?
Yes. I think and you can I'm sure you can chime in on this, but going back to the foundation of like asking yourself, one, either what do I truly want and how does that make me feel?
Mm,
And two, what are what's important to me? Or I was gonna say what are my core values, right?
yeah.
At the end of the day, what is important for me? And then again get in touch into your emotions of like, I want to feel at peace, right? So,
Mhm.
or I want to feel that I want to feel I'm appreciated. I want to feel calm, or I want to feel this space of love and grace for myself. And so, sit with those emotions and then ask yourself, like, okay, here are my options. Because I'm hearing you say, like, there's a lot of options now, right?
Absolutely. Yeah. A lot of things that people say
A
you need
lot
to
of
do
things.
to have a VBAC, which
Yes.
in
And
truth, you don't need any of them. People do nothing and still have a VBAC. So I want just to drive home, like, and I want you to chime in, like you said, but saying or
that's,
helping them on how to figure out what is best for them and not feel so
yes.
overwhelmed.
Yes, because I feel like, in any situation too, right? You have to, what about your lifestyle? What works for your family? I think those are questions because just like you said, we don't need any of those things and people still have a successful
Yeah.
VBAC.
Hmm.
And I think when we don't spend time reflecting, on ourselves and on our needs, then we look at what other people are doing and it's a shiny object syndrome and say like, "Oh, I think I need that to
Yep.
feel better."
Yep.
Just like what you said, it's not that you need anything to feel better. First, start with what do you need, right? Like what do you want? What do you need? And if you want to feel a certain way, what can bring that into your life, right? Is it but and just really being particular about it's like you first
Hmm.
examining, evaluating, right? What is your vision too? What is your vision for your family? Are those options going to put more restraint in your life, or is it going to feel expansive? Is it
Yeah.
going to help you feel more like you are free?
Yes. I love that word. And it's so true because I remember from my own experience, I felt like I had to do all the things because I felt like I was already behind even other people who were planning a VBAC because I had had three cesareans. So that was even more so like I was like, well, I have to do all the things because if I don't, I will fail. Like that was the mentality that was fed into
Oh,
me by seeing what everybody said that I needed to do or needed to have in order to, have the best chance at having a
that's
VBAC. So, I would stress myself out because I was like, I have to make sure I know all the research. I have to make sure that I listen to all the birth stories. I have to eat all the
wow.
dates. I have to go to chiropractic. I need the primrose oil. I need to make sure, like all the things, all the things. And it can feel so overwhelming. And I did feel overwhelmed, at a
Absolutely.
certain point, I was just like, okay, I can't do all the things because I would spend hours a day like researching, reading, listening to stories, like, and at, one point I had to calm down because I was like, this is bringing me more stress than ease.
Oh, good. I know. My daughter is a normal birth, and my son was a cesarean.
Yeah,
That emergency
right.
C-section of all
Hmm.
things that I had no idea.
Yeah.
is going to happen. So yes,
Yeah,
that's
so
very
it's
meaningful.
hard. It's hard, but I just want to make sure that everybody knows. And I love your exercise that you do, just like sitting in and kind of like visualizing what will make you feel
Absolutely.
at ease. Because that's one thing that I put like in my VBAC course is sit in silence and literally visualize your birth. How do you want to feel? How do you want people to talk
Yes.
to you? What do you want it to look like in the room? What do you want it to smell like? Like really going into all your senses and
Wow.
just like feeling into that, what you want it to be like, and writing that down, and then kind of like almost working backwards, like, okay, how can I get to that point? What do I need to
Exactly.
do in order to feel supported? Oh, okay, I need to find this type of provider to support me. You- So,
Yes.
just like that type of situation so that it can help you get a more clear picture. And I feel like putting it down on paper is so effective
Absolutely.
because then it's out of your head and you can actually see it on paper and be like, oh my gosh, like this is so much easier than I'm making it out to be.
Yes.
Yeah.
Yeah, that is so true. And I think visualization is so important. It's there's so much research, that's been done in
Hmm.
visualization, and it's been around for centuries, right? Just
Yes.
the art of visualizing. And if you are listening and you're new to visualization and you're like, I don't even know where to start or anything like that, again, you can use a timer. If you're like, just try to feel into like 1 minute, right?
Hmm.
Or if you really want to, not kind of like push yourself too much, you can start with 1 minute, 2 minutes.
Hmm.
Okay, I'm just going to sit here and try to picture, my vision and what it's like to uh, be in that space of when I'm giving birth, and who do I want in that space? What do I want it to look like, and things like that. So, spend that time, and then after the timer goes off, then you go on about your way and then just kind of revisit, again.
Yeah.
Because we're not used to, right? Like sitting
Hmm.
down, like, and just kind of pausing. So it's
Yeah.
okay if that is not something that you're used to. You can practice and kind of
Hmm.
build it in your day.
Exactly. And it's like with anything, when something's new, we're not just going to automatically feel comfortable or confident
Yes.
doing it. So it takes that repetition, trying over and over again, and literally starting with 1 or 2 minutes, setting that timer. When you're done, you're like, oh, okay, there's the timer. I did it. Like, and there's that,
Yeah.
because I used to feel that way too, like so awkward, like this is weird. And especially in our fast-paced world, it's like we're
Correct.
like, I don't have time for that. I don't. I'm too busy. But we can make 1 or 2 minutes of time for ourselves,
Yes.
just to try something out. And like with visualization, even top athletes do it. Like who was it?
Correct.
LeBron
Yes.
James. I think I've heard
Michael
him say,
Phelps
yes, they
also.
visualize what they're going to do, like
Yes.
swimming and getting the end and getting the medal or whatever it is. They visualize it before they even do it. So when they do it, it feels like
Yes.
they've already done this. They've already been here. So that's exactly how I felt. Like literally, I did visualization during my pregnancy. And when I
Wow.
gave birth to my son, I literally, like exactly how I visualized it, it happened.
It happened.
It was
That's
crazy. I was like, "Oh my
awesome.
gosh, this is amazing." So, yeah, I think visualization is underrated and it is so 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 helpful because it can help you feel like, "Oh, more confident because I've done this already." It might be in your mind, but you've
Yeah.
still done it. Like your mind doesn't know the difference between the action of actually doing it and like visualizing it beforehand. So, anyways, I could go on a whole tangent about visualization.
It is really helpful for sure. And
Yeah,
again, it's
yeah.
that reorganizing the brain when you're
Hmm.
sitting and you're visualizing, right? Yeah, it can definitely
Definitely.
help.
Yes.
Yes.
So thank you so much for this amazing conversation. I would love it if you could, or if you feel, called to leave this audience with like some lasting words of encouragement or tips or anything like that.
Yeah, absolutely. Um, don't feel discouraged. Don't panic, right? If you are feeling all the things, emotions are our body's signal to bring us back to what we need and to remind us if there's any unmet needs
Mm,
that we need to pay attention to. And when we lean into our emotions, it is something that can bring us more wisdom as far as, the next steps that we need to take. And as what we've said earlier, we are too much, in our heads. And it's okay to have those thoughts and it's okay to have those emotions. They can be catalyst for change. So don't be distracted with their presence, but allow them to exist in your space so that you can really find, the best path for yourself, whether you're having to make decisions about your birth, right, or raising your family
mhm.
and all the things that are important to you.
Absolutely. Oh my gosh, so good. Thank you so much, Joy. And if somebody
Thank
wants
you.
to connect with you or work with you, what would be the best way for them to do that?
Yes, my website is joyacaso.com and I have a free resource there. It's called The Calm Within,
Mm,
and it is just an ebook to help you with the tools to regulate your emotions in stressful times.
beautiful. Well, thank you so much. Again, this conversation was just so good and so helpful. Thank you.
Thank you.
I hope you loved that episode as much as I loved creating it. And if you want to learn more, be sure to download your free VBAC resource guide for even more tips and advice at birthingcometrue.com/VBAC guide. And don't forget to subscribe to the Journey to VBAC so you never miss an episode. Until next time, trust in yourself and remember, you are amazing no matter how your birth unfolds. Bye for now.